Good morning, everybody. It's Dr. Brace here. It's Facial Plastics Friday, and by request, I'm going to start a series on facelifts. Thank you for everyone who responded to the story last week, letting me know what you wanted to hear about. Facelifts were the winner. So I'm going to talk a little bit today. I'm going to go over some basics of facelift. I covered this about a year and a half ago, but we'll go over it again on a nomenclature of facelifts for this episode of Facial Plastics Friday. So the term facelift means something different to every surgeon. It's unfortunately not a medical term that means one thing. In essence, I guess it does mean that you are doing something to lift the cheek and the jawline, and that would be considered a facelift. This gets confused with a lower facelift, which some surgeons would call just the jawline and the neck, which also gets sometimes called a neck lift. And a neck lift could also mean a little incision here and doing some work on your platysmal bands or the fat, sometimes called a submentoplasty or a deep neck lift. So it gets very confusing, but what you should know is that the term facelift or neck lift is not a accepted term by all surgeons. So it's important when you're doing your research to find out exactly what the surgeon means when he says or she says that they're going to do a facelift or a neck lift. It's kind of like the example I used when I covered this a year and a bit ago was the word sports car. You could say I drive a sports car, and that could mean a Kia sport model. It could be a Lamborghini. There's a big difference between the two, but they're both technically a sports car. And so nomenclature is really important. So the things you need to know in a facelift are basically what exactly is your surgeon going to do. Traditional facelifts, the older facelifts, had incisions around the ear, so in front of the ear, so around the hairline, in front of the ear, down and behind the ear, and along the hairline, and that lifted the skin, and the skin got pulled to tighten things up. These are those classic pictures you see on Google Images and you see in presentations and you see on memes where people look windswept and pulled, and they look strange. And this is, I guess, the only word for it, a facelift that looks strange. And this is where facelifts get their bad rap. People say, they come in all the time and they say, I just want this, but I don't want a facelift, because what they're picturing is this kind of pulled tight, like you're in a wind tunnel kind of look. That's an old style of facelift, a skin-only lift that doesn't really happen anymore. It shouldn't happen anymore. Nobody really does that anymore. There's only very specific reasons why you would do that. The majority of facelifts now in 2022 focus on repositioning the SMAS layer. If you were to peel the face, if you were to make the incision and peel the face open in layers, like an onion, you have skin, and then you have a small layer of subcutaneous fat, and then below that, right in front of the ear, you have parotid fascia, which transitions into SMAS. The SMAS is an acronym. That's the superficial musculoaponeurotic system, and essentially what it is fibers of ligament and tendon and fat. It's a tough layer and some muscle. When I flex my neck here, you can see my platysma muscle. There's the band right there. I flex it, it comes up here and it becomes the SMAS. It's one embryological layer. It's muscle in the neck, comes over the mandible, and it turns into the SMAS layer, and then it becomes your orbicularis muscle, the muscle that lets you squint. So it's all continuous here. That's the SMAS, and a original or an older SMAS type surgery is where the SMAS, the skin is lifted, the SMAS is identified, and stitches are placed in the SMAS to cinch it together. And as you cinch the SMAS, the skin follows. And so then the tension is placed on the SMAS and your skin gets lifted. The problem with a SMAS suturing procedure, which is called an imbrication, is that it doesn't release anything, and it's a tension-based surgery. So you put everything on tension and you try to hold it, but we know from skin reconstructive surgery, if you put skin on tension, it stretches. And so the results don't last. You get all this stretch, you get this kind of minor improvement, temporary improvement, but things recur quite quickly. That evolved into skin, or SMAS excision, doing a SMAS imbrication, removing a strip of SMAS and then sewing it closed. And again, same results. You're not really releasing it, you're putting things on tension, and the results don't last long. This is where we move into deep plane facelifts, which was one of our requests to talk about deep plane facelifts. A deep plane facelift is when you incise the SMAS, you lift the skin, you get on the SMAS, you open the SMAS, and you go under the SMAS, and then you lift it up. The key to a good deep plane facelift is that you have to release the ligaments that hold the SMAS down to the bone. So that layer is not just floating in your face, but there's a big ligament here, the zygomatical cutaneous ligament. There's a mental ligament here, And down in the neck where it's the platysma, there's some ligaments holding it to the sternocleidomastoid muscle and some to around your larynx here. So to be able to move this mass significantly, you have to go underneath that layer, you have to separate these ligaments, and then a very powerful facelift can happen. The whole mass as a unit can be lifted up and there's no tension, which is the key. It can be snugged up quite high and the skin again follows, and then the skin can be trimmed tension free. And so you don't end up with a pulled look. You don't end up looking strange. You end up looking refreshed. You end up looking, the skin has been redraped and lifted really nicely. Extended deep plane facelifts are basically when you've released all the ligaments and you've dissected all the way down to the front, and then you start doing cuts in muscles to change the vector of pull so that you can start creating great sharp necklines. So a traditional facelift is from, say, the 1980s is very different from a facelift in 2022. It's important to know kind of what kind of facelift your surgeon does. Not every surgeon does a deep plane or extended deep plane release for a facelift because they're not trained in it, they're not comfortable in it, many reasons, but it is probably the most powerful lift in terms of repositioning things and having the skin follow. So it's not a lift based on tightening and stretching and pulling, it's a lift based on repositioning. And once you reposition the face, it scars in place and you have a longer lasting result. Facelifts have moved even more, even in the last, I'd say, 5-6 years, from just releasing, lifting, and repositioning to sculpting. And so the more advanced facelifts not only do deep plane release and deep plane repositioning, but removal of submandibular glands that are ptotic or excessive that cause fullness here, trimming of the digastric muscles, which as we age can become droopy and can give these big lines and fullness in the bottom of the neck. Those things are normal structures, but more and more patients are asking for and demanding more sculpted necks and more natural looking results without having these not quite complications, but these consequences of doing neck lift surgery where you expose these things. You expose the digastric and you expose the gland. And so a lot of surgery now, especially in my practice where I'm lifting a neck and an aged neck, is not only a deep plane release, reposition, and trimming of skin, but it's also sculpting normal structures so that you can get a beautiful neckline. So I hope that helps. That was a long one. Sorry, 7.5 minutes. If you have any questions about facelifts, stay tuned. I'm going to be talking more about the incisions and about the healing and about the post-op care in the weeks to come. But send us your questions anyway, and I'll try to answer them. Everybody have a great weekend, and that's it for Facial Plastics Friday.